What would you two like to start with? You want to start with how you got involved with this?
I'd like to start with your headline.
Okay.
Healthcare is human right.
Okay.
Yeah.
We just heard when we got here that your local member of Congress,
Scott Perry.
Scott Perry, spoke the other day and said that he agreed that healthcare is human right.
Yes,
that's
we
a
did.
major.
Yeah.
That's a major thing for a member of Congress to say, and I think I applaud him for that. I think the next step is to understand that human rights are not something that are commodities.
Mm-hmm.
Human rights are not profit centers.
Right. Right.
Human rights are not something that Wall Street investors should be making money from, or that the insurance industry should be ripping people off with very poor insurance, overpriced insurance.
Right.
It's not something the pharmaceutical companies should be ripping us off with. Mm-hmm. That's not how human rights are treated.
Right.
And so I think if your congressman needs to now start to think about, okay, it's human right, what does it actually mean? Mm-hmm. And what it means is human rights are something people have the right to. We have a right to health care. And there are ways for the government to provide that. I mean, the government. When I say the government, I mean all of us together to provide that and to take care of each other that way. Mm-hmm. And so I think when you start to think about what a human right means, I think that just changes a whole different mentality, because everything that, unfortunately, the Affordable Care Act that President Obama pushed, and the two coming up on three now plans that the Republicans have pushed, mm-hmm. say it's human right, but treat it as a commodity. Mm-hmm. Right. Treat it as a profit center. And that's just inconsistent. It's either a commodity or a human right. And if you're going to say it's human right, then it's not a market-based solution. It's a solution that's a public good, a public service, and that's what we're advocating for.
And I think what's interesting is that, people in the United States, and maybe it's because we're kind of an isolated continent. We have Canada and Mexico, but it's not like in Europe where you have so many countries close together. People here don't understand that we have human rights in the first place, mm-hmm. and what they are, and that our human rights are not being respected here. The conversations that we have here in the United States about people not being able to afford health care, people committing suicide when they have a serious illness because they don't want to bankrupt their family, mm-hmm. People dying unnecessarily. 80 people die every day in the United States because they don't have access to health care. Mm-hmm. People going bankrupt. If you talked about this in another country, and most other industrialized nations have health systems that treat health care as a human right, mm-hmm. people would just think that you're crazy. Like, what's wrong with you in the United States that mm-hmm. you don't get it? That we're all better off when we have our basic necessities met. So I think it's really important for people in the U.S. to even understand that we have rights, because we're so, I think, the commercial media and the whole market ideology has really taught us differently, mm-hmm. that it's all about rugged individualism, and you have to deserve your health care. You don't just get your health care.
Margaret mentioned 80 people a day die each year in the United mm-hmm. States. Mm-hmm. That's 30,000 people a year.
Mm-hmm. Right.
On top of 30,000 people dying each year from not having access to this human right, imagine that. Mm-hmm. 30,000 die from not having access to what people believe is a human right. Yeah. Hundreds of thousands go bankrupt. Mm-hmm.
And most of them have health insurance.
And 2/3 of those people have mm-hmm. health insurance.
Yeah.
But health insurance is a charade. I mean, it's another mirage.
Right.
What do some of the healthcare people call it? It's an umbrella that melts in the rain.
When you need it, it's not there. Yeah.
Because what makes this even more pitiful is that we know the solution. We have the solution. We've tried the solution for one of the most difficult populations in the country, the elderly and the chronically ill. Mm-hmm. Two of the most difficult populations in the country. Mm-hmm. And that's Medicare. Medicare has been in place now since 1965. Mm-hmm. It has 3% overhead compared to the insurance companies who have 17 to 18% overhead and cause a lot more overhead for everybody else with their bureaucracy. But 3% overhead, and it serves a difficult population, and the proof is that it's worked. It's made the elderly population healthier. It's made them more equal, because human rights mm-hmm. means equality.
Right.
It's treated healthcare as a human right for the chronically ill and the elderly. Now, Medicare has its problems. My father's going through a very serious health problem right now, mm-hmm. and I'm seeing it up close and personal. And so there's definitely some improvement. So we advocate for improved and expanded Medicare for all. Right. Mm-hmm. We want everybody to have access to an improved Medicare system. And if we did that, it would be such a burden lifted from so many people and from so many families. and it would have a major impact on the family economy, the ability, not paying premiums anymore, not having co-pays, not having deductibles, all that.
Not having to worry.
I mean, you have to pay taxes.
You can
You
afford
pay
care.
taxes, but it's going to be less than you're paying the insurance companies
Right.
and what you pay for health care. And so it's a tremendous financial saver for every family in the country. And it's a financial saver for businesses, because rather than having unpredictable premiums and having to hire a human resources department to figure out which insurance should we get and going through all that bureaucracy of the insurance companies, they can just know I'm going to pay X percent taxes, and I know when I hire someone I'm going to pay an X percent tax on that person. So it's all plannable. You can plan.
Right.
Much better for business, much better for the government. Although I know some politicians make a lot of money, from the insurance industry and the pharmaceutical industry and from Wall Street. May not be better from the perspective of donations, but it's definitely much better for how the government operates.
Right.
So
The Medicare system, which has been so successful that actually other countries have used it as a model for their universal healthcare system. So Canada used it for theirs. Taiwan sent a delegation around the world to study all the different countries' health systems and came back and modeled theirs on our Medicare. Our Medicare system, which is a very efficient system and handles, as Kevin said, much populations that have a lot of health needs, is operating inside of a very toxic system where we don't have a way to control healthcare prices of services. We don't have a system that negotiates for fair prices, so they're all over the board. Medicare is not allowed to negotiate for the price of pharmaceuticals. So that makes it, a stress on it as well. And then a couple of decades ago, the United States started to privatize Medicare. So we allowed in these private Medicare Advantage plans that are literally run by health insurance companies like United Healthcare and others. The private plans have been attracting the healthiest seniors, and then when
because they're marketed to them.
Yeah, they have all sorts of ways to market to the healthy seniors. They cost more than our traditional Medicare, so we spend 14% more on these plans that cover the healthiest. And then when those seniors start to have health problems, they have incentives for them to leave and switch to traditional Medicare where they can get better benefits. So the healthy go in.
Let's
the
think
sick
about
go
that for a
out.
second. Let's emphasize this for a second. Medicare Advantage. Insurance companies come in to take their share of that very big market, of elderly and ill,
Right.
and they make sure they get the ones that don't need health care.
Right, so they're not paying
They
out.
charge them premiums that you wouldn't have to pay if you were a Medicare. So they charge them more, and they make their plans so lousy that when you actually start to need it, you want to leave Medicare Advantage and go back to traditional Medicare.
Yeah.
So you
Right.
pay for it, you get less, and on top of that, they take money from Medicare itself.
Right.
So they weaken Medicare.
And this was one of the promises
Yeah.
that the Obama...
Isn't that crazy?
Yeah,
Is that insane?
I often say that the United States, which we're the only country that uses this kind of system.
Only developed country.
Only developed country that treats healthcare as a commodity and profit center like we do. And we've been doing this for about 4.5 decades now. And if we had actually treated this as the experiment that it is, because it is unique in the world, we would have ended it decades ago on ethical reasons. We spend the most of any industrialized nation, twice what other countries spend. We leave tens of millions of people out, tens of millions of people who have insurance but they can't afford to use it or get care. Our health outcomes are poor related, compared to other countries. Our life expectancy is actually decreasing now. And so, so our children are not going to live as long as we're going to live. And so this is the result of having this market-based system.
And it's not just, by the way, because of diet and smoking. They smoke more in Europe.
Right,
You know,
and they
so
still live longer.
They
and have
still
better
live
health.
longer. I mean, so
And
our
spend
healthcare
less.
system is one of the major reasons why our life expectancy is shrinking.
Right.
That needs to be understood.
Yeah.
When you mentioned the $700 million, billion dollars in waste in the current system, a big chunk of that, about $500 billion, is the insurance industry. Not only does the insurance industry use 70% of its money, 17 to 18% of its money on its own overhead,
Right.
which includes massive CEO salaries.
Tens of millions.
Tens of millions a
dollars.
year.
Yeah.
Obscene salaries
Right.
for these people. And they've all done very well under Obamacare, by the way. The health insurance industry has gotten much wealthier. But they also create bureaucracy for all of us. So many hospitals actually have more billing agents than nurses.
Right.
Doctors' offices, 20% of their overhead, at least, into billing from the insurance companies.
Right.
Doctors' time They spend a lot of their own time on dealing in the insurance industry, getting permission, from some non-medical degreed billing administrator from the insurance industry saying, no, you can't do that for that patient.
Right.
And why? Because I say you can't, and I'm not a doctor. I'm just practicing medicine without a license. So if you realize that $500 billion of that waste is the insurance industry, then ask the question: why do we need the insurance industry? What do they actually provide? They are a middle corporation between the patient and the healthcare provider. I don't want the insurance industry between me and the provider. I don't want them negotiating, where I can go to the hospital or what kind of health services I can get, what kind of pharmaceutical drugs I need. I don't want the insurance industry between that. So not only do they do nothing, they actually get in the way.
They're harmful.
And they cost us $500 billion in wasted money. So why do we support them? It's insane. So they should be, and how anyone can think that when you have a profit-making insurance industry, and many non-profit insurance, by the way, they profit in their own ways. And we can talk about that if you want to. But the openly profit-making insurance systems, how can someone that takes money off the top, essentially, to be a middle corporation, blocking my communication with my doctor, how can that be how can that be more efficient than getting rid of that?
Right.
When you put that kind of profit and bureaucracy in the middle, it can't be more efficient. It makes no sense.
Right.
So I hope that your congressman will actually listen on this and think about it, because I think every Republican should be leading this fight for a national improved Medicare for all. This is really a Republican issue if they understood how much money it saves.
Right.
And one reason why the Medicare is having some problems, and a lot of it's designed by the bipartisans in Washington, putting in place all sorts of rules that make it having problems. A lot of the problems come from the bipartisan in Washington putting in place rules that make it difficult. But think of it, they're dealing with the most difficult populations, elderly and chronically ill. Now, if you add to that population the rest of the American population, the U.S. population, you'll be dealing with young people. You'll be dealing with people who don't have health problems, and so that's what makes insurance work. We've heard this about Obamacare. Not enough young people are signing up. Well, the reality is, if we have a everybody in, nobody out system, then Medicare becomes much more financially strong. Then they have the power also to negotiate drug prices. They have the power to negotiate prices for medical devices, for all sorts of medical services. They can control the price, and they also can put in all sorts of ways to minimize the waste and bureaucracy of, like, hospitals, for example. One thing that a Medicare system would do would be have a global budget for a hospital. So you look at the hospital, what it's doing, understanding what it's spending money on. You give them a budget for the year. They don't have to count every Band-Aid. They don't have to count every pill. They get a budget. All that bureaucracy disappears. And they get to just be a hospital serving patients. So it saves them money. So throughout the whole system, we'll see tremendous savings if we go to this approach. This is why Republicans really should be leading this effort, because this is a system that is efficient and ensures that everybody has their human right to health care.
And I would encourage more physicians to be speaking out about this too, because the average physician in practice is spending about $70,000 a year just on the billing part of their practice, and that's a huge waste of money. And the frustration, I practiced for 17 years, and I've been doing this advocacy work full time for about 10 years. And I've been speaking, I go around and do presentations at hospitals. I've done it at York Hospital here before, about Medicare for All. And over that time period, I've been witnessing how physicians react to what I'm saying. And what I'm seeing now is a level of desperation by physicians that I have never seen before. We know that primary care providers are burning out in 10 to 15 years because of the way the system is, because you're fighting to get paid, you're fighting to get care for your patients. You can't, with Kevin's, father who's having his health problem, and I talked to his doctor about, what was going on. I had to say to the doctor, because he's like, but the insurance. I'm like, but you're the doctor. You're the one who's supposed to be in charge.
They're so disempowered.
And he's
They're
just
so
like, but the
disempowered.
insurance, and I've talked to heads of departments who have said at hospitals that insurance companies basically said, we're not going to pay you. They offered them a deal. The hospital said that's not enough.
That's not a fair deal.
The insurance company said, fine, then we're not going to pay you anything. And then that
Mafia
went on
tactic.
for months.
Yeah, that's
and then finally the hospital had to come back and say,
The hospital was going into debt, hundreds of thousands of dollars,
like what
for their
will you
emergency
give us?
room.
Yeah. And that's the same way they were treating
And so the hospital
physicians.
got on its knees and took whatever the insurance company would give them.
But that's
That is mafia tactics.
yeah, that is.
But that's exactly how they treated us in private practice. They basically would say, here's your contract, here's what we'll pay you. You had no say, and it was a take it or leave it deal. And so, this is not how our health system has to be. We have the power to actually make it different, and it's hurting us in so many ways to have a health system of this type. So.
The mafia should not be determining our human rights.
Right.
No.
That's another.
And that's what we have.
Yeah.
We have a health insurance mafia. We have the pharmaceutical mafia. Look what the prices they charge.
Yeah.
I mean, you can
Not
tell.
related to-
You could tell some of the prices compared to when you practice to now. It's just
Right.
it's obscene.
Yeah.
And then then you have the Wall Street investors. Every year there's a conference in Washington D.C. Wall Street comes to Washington healthcare, so Wall Street can figure out how they can profit from people's illness.
Right. Right.
And at the conference, Margaret interrupted one of them which was a great event.
2011, yeah.
When she actually walked into that conference and sat and listened to them, and then at a certain point she got so disgusted she got up and said, "I can't believe you're saying this."
Well, I registered, and I was going to ask a question during the question and answer period. It was literally Goldman Sachs, Citigroup, Wells Fargo, J.P. Morgan Chase. They were the ones sitting at the
Wow.
table and the panel, and they were talking about how they could profit off of healthcare. And at one point, one of them said, "Well, if we go too far,
amazing.
we risk public shaming."
We risk public shaming if
Oh
we go
my
too
God.
That's
far.
what he said. And I turned to the person I had a couple people, support people in there with me. One was a videographer, and I just turned to him and I said, I can't sit here any longer, because I was sitting there and I was taking notes on what they were saying, and they were twisting everything around, in their, and so I just grabbed a microphone and I stood up and I said, well, you should be ashamed of yourself right
Yeah,
now.
they should.
Yeah.
Definitely.
Even discussing
Yeah.
doing things that would risk
But they
public
know,
shaming
right.
when people are suffering.
Right.
Yeah.
It's just incredible.
Yeah, that's what we're up against. But the good news is, in all the time that I've been doing this work, and people I know have been doing it for longer than me, we are at a point now
That's right.
where I think we can actually win Medicare for all, despite the fact that for years the corporate media has portrayed Medicare for all as a negative and told people single payer is socialized and it's terrible.
Yeah, that's
and
just-
all this bad stuff. People still, majorities of the population wanted it, and now we're seeing support levels I've never even seen before. So this is a very exciting time.
We're seeing Republican support going up.
Yeah,
significantly.
among Republican voters. Yeah, we're seeing majorities of some Republican populations.
It's really amazing. And so the support is supermajority support. It's 60% support
Right.
for the general population. Republicans are getting into the 40s. Democrats are about 80%. And so you're getting this much broader. And I think a lot of it's because, first off, we see the failure of the Affordable Care Act. Obamacare is not working. Sure, more people are covered, mainly by Medicaid, which is not very good medicine. That's medicine for the poor. And while it is better than nothing, it is still not good health care.
Right.
So that's, yes, they got it, but it's not necessarily the victory we want. Because people need to have good health care. And then you're seeing the premiums going up. You're seeing the deductibles going up. You're seeing the co-pays going up. You're seeing the networks that they cover shrinking. So you're paying more, getting less, and you're seeing these astronomical increases in profit for the insurance industry. So Obamacare is not working. Now the Republicans are trying to fix some of that. I mean, they're
fix in their
well,
way.
I mean, one of the things in Obamacare that's terrible, and the Republicans don't like also, is people are forced to buy
Right.
insurance.
Yeah,
Private
that's
insurance.
That's
that makes
obscene.
no
How can you
sense.
have the
Yeah.
government forcing you to buy any product?
right.
Especially when that doesn't work very
Especially when it doesn't work
Yeah.
by a mafia.
Right.
I mean, it's crazy. So that bothers the Republican advocates for repealing Obamacare, and there's other issues too, of course, that need work. And everyone, it's interesting about the debate about repealing the ACA is everyone agrees it's not working.
Right.
Even the defenders of the ACA, it's got to be fixed. Well, now the Republicans have tried twice so far. They're about to try a third time to fix the ACA. And what they find out is when they try to go further to the market, they actually do more harm than good.
Right.
Tens of millions more will not have insurance. Prices will go up. They're not controlling prices. The deficit in the government will go up. So everything they try actually makes things worse.
Right.
You know why? Because the only direction you can go to fix the system is to go to what's already worked in the United States on the most difficult populations, elderly and chronically ill, and that's Medicare. Improve Medicare, and it has to be improved. Improve Medicare for all. That is the path. And I hope that Republicans, after they've tried this third time, 3 strikes and they're out, that they recognize there's only one path, and that path is Medicare for all.
And I think, other countries, they recognize that when you have a health insurance that's for the poor, it's a poor system. And that when you have a universal health system that every person is in, it raises it up for everybody because, people at the top are not going to tolerate a bad system. And they're they tend to have the most voice. So it really, a universal system is a higher quality system because you drive it up. So that's what we need. And that's what people want. And we have legislation in Congress. We have a bill in the House, as you know, H.R. 676, the Expanded and Improved Medicare for All Act. We now have 102 co-sponsors for that.
Which is 10, I think the previous record was 93.
Right.
Oh, wow.
So now we're 102.
And growing.
And growing
And
every
that's
day.
because
Every day.
people are very active. People have been going to the town halls. In fact, if we weren't here tonight, we would be at our town hall in Baltimore with our Healthcare is a Human Right
Well, I'm
campaign.
glad you came here.
Yeah. Well, I promised you before I learned about the town hall. So we have a good team down there, and they'll do a good job.
And the Healthcare Human Right campaign in Maryland partners with
put people first.
with your local
We're part
group.
of that network.
Put people
Yeah.
first, so people should know that group. Put people first.
Yeah.
Get involved locally with that group because they're doing good work as
Yeah,
well.
we try to get people all the time. We're always trying to pull them in, and it's just, I think, I've talked to one of the co-founders, Nijmi, about this, that there just seems to be this hopelessness and this learned helplessness that is so hard to get unstuck.
That's why we call our campaign HOPE.
Yeah.
Health over profit for everyone. And anyway, this is a national campaign, so everyone should really join it.
Right.
Health over profit for everyone. It's healthoverprofit.org, and because the major, it's not we know the solution. It's tried and true and proven.
Has public support.
It has widespread public support. We know it'll stop those unnecessary deaths every year, those 30,000 unnecessary deaths. It'll stop the bankruptcies, the hundreds of thousands of bankruptcies from medical problems. We know it'll do all that. The problem we have is politics.
Congress.
And people feeling like they have no power, that they can't win, and that Congress is just listening to the insurance companies and the pharmaceutical companies and Wall Street. There's a lot of truth in that. But we also know, because we've done a lot of different issues, we've worked on lots of different issues, and we've won issues that people said you couldn't win.
Right.
And we know we've won them. And so we know that people who are organized and mobilized can win. And they will win. And it doesn't even take that many people. There's been more than 100 years now of people using resistance movements and mobilized people to try to change things since Gandhi. Gandhi is the 1890s. And since that time, there's been a lot of movements around the world. And what the research shows is that those movements always win if 3.5% of the population gets active. Just 3.5% gets
If we have
active.
national consensus on an issue.
We already have national consensus on the issue.
Right.
That's the other ingredient.
Right.
The 3.5% has to represent a national consensus issue. And we have national consensus.
Right.
2/3 of the public and growing supports improved Medicare for all. And so we have national consensus. We just need the people to get active. And so HOPE, healthoverprofit.org, is how we're trying to get people active.
This is how social transformation happens, is that the public does have the power. You have to just shift that whole political culture. And this is what we're doing with Medicare for All, is making it the only politically acceptable solution. And so I feel very confident that we can win this.
We're
struggle.
confident that we can, people, when they understand Medicare, we already have supermajority support, 2/3 of the public. So we have a head start.
Right.
Thanks to people who've worked on this for a long time.
Yeah.
But as the public learns about Medicare for all, including your Congress member, as he learns about it, he's going to realize it's the only path. And he's going to wants to be on the front of that wave, because he does not want to be against something that's as popular as motherhood. And that's what Medicare for all is going to be. It's going to be so popular that you do not want to oppose this. Every family in your district will be benefited by having Medicare, an improved Medicare for all system. And you do not want to be the member of Congress who said, no, you can't have that.
Yeah.
Because you will be opposed. And even in a safe district, A safe district will become an unsafe district if you're on the wrong side of this issue. That's where this is going. And I hope that members of Congress see that coming, because they need to get on board. They need to get educated. Once they get educated, they'll be on our side.
Right.
We're confident of that. Yeah. Now, one of the interesting things about the Affordable Care Act is that it also recognizes the need for prevention. And it gives people access to prevention.
To preventative testing.
Preventative
screening
testing.
tests,
Yeah,
right.
that's what I'm talking about, screening tests,
Right.
like she was describing.
Right.
But what it doesn't provide is access to the care once you find out you have the illness.
Yeah.
Yeah, so that's what the doctors
The bizarre
I'm talking
backwards
to.
nature.
They're saying now we can diagnose patients, but they can't necessarily get the treatments. And this was a way that the insurance companies gamed the system. So they were required to cover all people regardless of pre-existing conditions, which is a good thing. But we know that the private insurance companies, their bottom line is making profits for their investors. So they always find a back door to work around that. They created these ultra-narrow networks that actually leave out major medical centers. So the ultra-narrow networks leave out 70% of the health facilities in your area. So then
You have cancer, and the cancer
cancer center is not
included in your
not
network.
in your network. So then you're out of network. You have to pay out of pocket for that, and that doesn't even qualify for your deductible. Your high, your multi-$1,000 deductible that people have.
You
to
pay your pocket and have a high deductible, and after you pay, you still have a high deductible.
Right, right. So it's
And you're still sick.
and
you're
you're
still
still
sick,
sick.
yeah.
Yeah, and this is why we continue to see high rates of people that can't afford the care that they need, that are going without, and exactly the same situation that you talked about is happening, where literally people have to decide between, am I going to get cancer treatment, or am I going to keep my house? Am I going to be able to, send my children to college? These are decisions that people in the United States, the wealthiest country in the world, are facing, and this is ridiculous. Well, there was a young woman that that we knew who was with us, and she came in, when we got upstairs and we decided just to block the whole hotel, we sat down, and she came and sat down with me. And so there was a lot of news media out there covering it, and there was a big picket, and we decided, we sat there for a while and shut down the hotel, and then we're like, well, what do we do now? And I said, she had a story, and I said, would you like to tell your story to the media before they leave? And she said yes, and I said, okay, we're going out. And we went out, and when she was 19 years old, her father was diagnosed with a brain condition, and it was going to cost a lot of money, and he was worried about leaving the family bankrupt. So he literally, one day while she and her sister were at school, he returned, the book. He took everything that he had borrowed from anybody, and he put a little sticky note on it with the name of who it belonged to. He put out all of his credit cards and the statements on the table. I think he even took the cat to the shelter, and then he went outside in the backyard and he called 911 and he shot himself. So that by the time that his daughters came home, the police would already be there and take his body away. And that was the decision that he faced.
And that's not uncommon.
No, it's not uncommon.
That is not uncommon. And yet people call it a human right and then make it a commodity?
Yeah.
It doesn't make sense.
Gandhi said you can't compromise on fundamentals because it's all give and no take. So we draw a line. When you look at this from a standpoint of, a health policy standpoint of what works, the smallest step that we can take right now is to go to a single payer Medicare for all healthcare system. There's a whole lot more that we have to do after that, but a single payer system.
And those are negotiable.
Right.
Those
other things are negotiable.
We can debate about, but the basic.
Right. But the basic is that we have to get the profiteering out of it. We have to create a universal system that's paid for up front through public dollars, and then we can start to look at, in that system, how do we make it better? And that's what every other country that has this kind of system does, is every year they improve it. And the people speak out and they say, hey, we want this, we're not getting this covered, and we want that, or this, we don't have enough doctors here, or we don't have whatever. And you work to improve that system. No system is perfect, but at least when you have a universal publicly funded system, you have something to work with. And then it impacts other areas of public policy, because in Europe, where they have all these universal systems, they don't sell GMO foods because they know of the health impacts of that. They don't put gas refineries in residential neighborhoods because they know they're going to pay for the health impacts. So a universal system has a lot of positive benefits.
And one of the things I just want to mention about the rhetoric, and one of the things that both parties, especially the Republicans, push is this idea that people want to have choice.
Right.
Yeah, we want choice, but not choice between two health plans. We want choice between which healthcare practitioner we
Right.
go to,
Right.
which doctor we go to,
Which
which
medicine
hospital we
we
go
get.
to, which
Yeah.
medicine we want, which treatment we want. That's where we want the choice. And what's great about a Medicare for All system, it increases those choices, the real choices.
Right.
Who cares, which middleman you have that you don't even need? It's going to rip you off. We get rid of that middleman, and we focus on the real choice. How do I get the best health care in my community?
Because every health professional is in the system, so now you get to choose. As
There's
a
no
patient.
network. Everybody's in,
Right.
including the health professionals.
Right. Yeah. Look at high blood pressure. We're seeing in this country people having strokes and kidney disease in their 40s from high blood pressure. And we know that if people had access to regular medical care and monitoring and that things to lower their blood pressure, we wouldn't be seeing this. So we won't pay for them to get those primary care visits and those medications, but when they need dialysis because now they've killed their kidneys from their high blood pressure, we'll pay for their dialysis, or they have a stroke and then they end up in Medicaid and rehab. It's really a system that is cruel in a lot of ways and doesn't make any sense.
And that's why it increases the prices too.
Right.
That's why we pay 18% of our GDP is health, the health programs. Compared to most countries, they're 10%. We're like
Right.
double the per person spending
Right.
on healthcare than other countries. We spend a lot more because we use the least efficient, the most really criminal system of treating a human right as a commodity for vultures to profit from.
Or an insurance company that's telling a doctor, you only have 20 minutes for a visit.
Oh,
Right.
jeez.
Yeah.
I hate that.
Yeah, I remember I used to write prescriptions and I would send the patient out and they'd go to get their prescription filled and then the pharmacy would call me and say, well, you need to call the insurance company and get authorization. I'm like, isn't a prescription like here I've said the patient needs it.
Right.
Why do we have to do another step here? But you did, I have to call up the insurance company and
It's part of the unnecessary bureaucracy.
Fight with them, yeah.
500, that's the part of the $500 billion in waste. Every one of those times that you have to do that, that's waste.
and it takes away
Constant.
from patient care.
And makes it,
patient
that's right.
time.
Yeah, it's one of the absurdities of many in this system.
Yeah.
But I think we can win it, and that's the most important thing.
Well, I feel good about it
We
too.
feel good. We see tremendous growth. We started the Health Over Profit for Everyone campaign last November, and people are joining. People are getting active. People are becoming citizen lobbyists that are focused on their member of Congress. We provide people on the website with the contact information for healthcare staff, so people can call directly and get and talk to the staff member about the issue. And we provide people each week with information for that week that we want to make sure that people in Congress hear about. And we have weekly phone calls where people can come on and get more detailed
Every other
education.
week.
Every other week. Yeah,
Yeah.
weeklies already would drive me crazy. every other week is enough, and people
There's a lot to
people
do.
get educated,
Yeah.
in depth. And so we're creating a group of people who are mobilized and well educated, so that when they talk to their member of Congress, but more importantly, talk to people in their community, when they hear something like the member of Congress saying Medicare's dying because it's going broke, we'll have the education to respond to that. He won't get away with that.
Right.
I mean, he's also uneducated about it.
Right.
Congress members have to deal with a lot of issues. It's impossible to be well informed on everything. It's our job to inform them. And so when he says something like that, in fact, the next phone call,
It's about the economics.
It's about the economics.
We have an economist
an
coming.
economist coming
this
on
Monday.
to talk about that, so we can
Yeah.
deal with those kinds of questions, explain them to people so they understand. When a Congress member says that, here's the response.
Yeah, one of the things we found in 2009 was that a lot of the health staffers, who really are the ones advising the members of Congress, didn't have an understanding of what Medicare for All was or how it worked or why it was better. And so we did a lot of citizen lobbying, bringing in medical students, nurses, and doctors to sit down and explain health policy to them. And so this time around, we're doing it through these citizen lobbyists, and we provide the tools and information, and we also serve as a resource. So if someone is a citizen lobbyist and their Congress member needs information and they don't have it, they come to us, we provide it. So it's a way that we can really shift this political culture, educate our members of Congress, get them to know how to speak about this issue, and that's how we're going to win.
Okay. Well, Ace is giving me the 2-minute piece on, since we can't see our monitor, because for some reason our monitor went out.
Yeah.
Do you, closing thoughts? So we have 2 minutes.
I'll just be brief, then Mark can say something. People should go to healthoverprofit.org, get involved, find their own local groups around the country, get involved with the local groups here, and get involved in this issue. It's a winnable issue. It's time is right. The Affordable Care Act is failing. The Republicans can't replace it. Every time they try, they make things worse, and can't get even through the House. And so it's time for the real solution. This is the moment, and it's been coming for a long time. We have popular support. Now we need a popular mobilization, and if we do that, we can win.
Right, and it's it's going to be a fight, but one thing I really want people to understand is that Medicare for All was off the table when the Democrats had power, just like it's off the table when the Republicans have power, and that it's important for us as people to recognize that we're the ones who are going to put it on the table. It's not about who's in power, it's about what we do.
That's
and
right.
So, the Democrats are saying, wait, we have to win first before you can have this, but we did that in 2009, and that didn't work. So it's really important that we understand that the time is now to fight for Medicare for All.
Okay, well, I want to thank both of you because I know we're really coming up on time here. Both of you, please come back.
We will.
Together,
Thanks.
independently, we can talk about a whole lot of other issues. I will definitely post all this information on the Facebook page. We apparently live streamed, so that was good. So at least it's up there so people can watch and
Great.
share it. And thank you so much for coming on.
Well, we
thank
appreciate
you.
your work,
Yes,
both on
thank you
healthcare,
so much.
but also on doing local media.
Yeah.
This is so important. People just do not trust the media for good reason, so your work is very important.
Well, I want to thank you, and I think we're pretty much done. I'm going to wave goodbye because Ace is counting down. Okay, there we go. All right, thank you.
Great, thank you.
That
And
was
thank
good.